We are leaving Danbury Hospital, and we're just going to go quickly downtown area, see what's going down. I try to have as much daily contact with the downtown area as possible.
I think one of the unique things working at Danbury New Milford Hospital is that most of the people that work at the facility live in the community. So we really have a vested interest in making sure that the people we take care of, which are our friends, our neighbors, sometimes extended family, that we do the optimal best job that we can.
We don't have as many resources that some of the larger cities have, so we have to make more out of the resources that we do have. That's why CCT has been a great addition to our community.
So the community care team, it's a group of stakeholders from the community. So it's everyone from the homeless shelters and soup kitchens, mental health providers, substance abuse providers who come together in the same room, and we develop care plans for really our most vulnerable patients.
We have police officers who are community police officers who attend the meeting. We have social workers. We have experts in housing. We have experts in substance abuse. We have experts in behavioral care. Basically, it's having a dozen different sets of eyes and minds on the needs of a particular patient.
A lot of the people who are served by the community care team are just everyday people that may have gone through problems in their life that forced them, for whatever reason, to kind of be out on the street on their own.
They would be forgotten people. There would be people who would be coming to an emergency room repeatedly, but there would be no follow-up. There'd be no other additional supports for them.
Through the community care teams, we meet the patient where they're at. We help identify what would be the most appropriate services in order to provide that individual to get them back on their feet.
It is rewarding, but in the sense, diving into this work, it's not a everyday happy job. You guys met Ed. Ed is a great guy, and his sister calls him a miracle for a reason.
Ed was living outside in New Milford for 9 years, and the community care team put together a group that came together and came up with a way to help Ed to heal his leg and to get him housing and to get him medication.
People were expressing a lot of concern for Ed because he was in the elements. He did have an infection on his leg that was pretty traumatic. He was definitely exhibiting some mental illness. He was getting compassionate care from the community as somebody would buy him a cup of coffee, but in the same sense, he was never engaged in any mental health treatment or addressing any of the issues with him in his life.
Normally what I would do is I would email Peg when I was about to drive over to New Milford from Brantford, just in case there's anything I needed to know. And she said, actually, Kevin from the community care team in a mobile intervention unit just took Ed to the Danbury Hospital ER to have his leg looked at.
So I was picked up by the team and supported by the team. I spent some time in the hospital, and the hospital found me a place to live.
Watching somebody succeed is the best feeling that you can have.
I think one of the great things about the community care team is that you don't need to travel halfway around the world to find some worthy cause to participate in this. The needs are great right here in the city of Danbury and the surrounding towns.
My biggest fear is that I come into one of these meetings and I'm told, hey, we're not able to do this anymore because either funding ended or because priorities realigned.
It's fair to say that in these times where federal funding and state funding is at risk for our most vulnerable populations, that this work could not be done unless we had the support of the community and the support of our philanthropists.
I would encourage people to support the community care team. This is a team that would be able to do and manage outreach and follow-up support in a way that no other organization is doing currently in the greater Danbury area.
Without philanthropic support, we wouldn't have Kevin. We wouldn't have the other navigators, and individuals who need the most help wouldn't be getting it.
The community care team is making this community a better place.
We celebrated his 50th birthday on April 9th. It was amazing.
Yeah, we did. We had a good day.
I thought I was going to write his obituary, and I'm writing a book about my brother. That's how inspired. He's completely changed my life around.